Welcome to ATCM, the Emergency Medicine channel. Today, we are going to discuss the drug Noradrenaline. In this module, we are going to discuss the classification, the mechanism of action, the pharmacokinetics, the indications, contraindications, the drug dilution and dosing, and finally, the complications and side effects of Noradrenaline. So, first we come to the classification of Noradrenaline. So, the noradrenaline is both an alpha and beta adrenergic agonist. It is a vasopressor as well as a sympathomimetic. So, noradrenaline is an alpha and beta adrenergic agonist. Coming to the mechanism of action. Noradrenaline acts on the alpha 1 receptors, the beta 1 receptors, and the beta 2 receptors. Its main action is on the alpha 1 receptors and mild action on the beta 1 receptors, or very minimal action on the beta 2 receptors. So, its primary action is on the alpha 1 and very mild beta 1 action and very minimal beta 2 action. So, it acts on the alpha 1 receptors. It is an adrenergic agonist that causes vasoconstriction of the smooth muscles, thus increasing the peripheral vascular resistance, thus it increases the BP. So, it acts on the alpha 1 receptors causing vasoconstriction of the smooth muscles, increasing the peripheral vascular resistance, thus increasing the BP. It has a very minimal action on the beta 1 receptors of the heart, thus it also contributes a mild increase in the cardiac output. It has a very minimal beta 2 receptor action that causes vasodilatation. Now we come to the metabolism. It has a rapid onset of duration, that is around 1 to 2 minutes, and it is metabolized by the monoamine oxidase and the catechol-methyltransferase, and finally it is excreted through the urine. Now we come to the indications of noradrenaline. The utmost indication of noradrenaline comes in the setting of septic shock. It can be also used in other vasodilatory states. It can also be used in hepatorenal syndrome type 1 and in AKS. It can be used in post-cardiac arrest shock also. So, the primary action or the primary indication of noradrenaline is in the setting of septic shock and other vasodilatory states. It can also be used in hepatorenal syndrome type 1 and other post-cardiac arrest shock scenarios. Coming to the contraindication of noradrenaline. Hypersensitivity to noradrenaline is one of the absolute contraindications. Other than that, there is no major contraindications for noradrenaline. Coming to the side effects and complications of noradrenaline. The major side effect of noradrenaline is that it is ideally preferred through the central line than the peripheral line, as it can cause extravasation and tissue necrosis. It can also cause peripheral ischemias in less than 1% cases, and also cardiomyopathies and bradycardia and cardiac arrhythmias has also been documented. So, coming to the complications and side effects of noradrenaline, the most common complication which we should remember is the extravasation and the tissue necrosis if it is administered to the peripheral line. So ideally, a central line is required for large doses of noradrenaline. Other complications include cardiomyopathies, peripheral ischemia in less than 1%, bradycardia and cardiac arrhythmias. Now finally coming to the dilution and dosing of noradrenaline. Coming to the dosing of noradrenaline in the setting of septic shock, the starting dose is 0.05 microgram per kilogram per minute or 0.1 microgram per kilogram per minute to 2 microgram per kilogram per minute. So the dosing range varies from an initial starting dose of 0.05 to 0.1 microgram per kilogram per minute to 2 microgram per kilogram per minute. Come to the dilutions. 1 ampule of noradrenaline contains 2 ml, which is equal to 2 mg. So we will take 2 ampules of noradrenaline, which is equal to 4 ml, and we will mix it in 46 ml of NS, that amounts to 50 ml, and 0.1 microgram of noradrenaline, that comes to 4 ml per hour. So coming to the dilution, 1 ampule of noradrenaline is equal to 2 mg, which is equal to 2 ml. So we will take 2 ampules, that is 4 ml of noradrenaline, that is mixed with 46 ml of NS corresponding to 50 ml, and we will take at an infusion rate of 4 ml per hour, which is corresponding to 0.1 microgram. So we have discussed the classification, the mechanism of action, the indications, contraindications, the side effects, and finally the dosing and dilution of noradrenaline. Thank you.